How do you know if your scope or niche is too narrow? Again, I only see women's mental health and reproductive psychiatry in my practice. I've gotten 3 patients in 3 months. I get that it's summer, but I'm wondering if my scope is just too narrow for a cash-only practice. So let me answer this question specifically, which is I understand like 3 patients in 3 months isn't a lot, but summer is really slow, and women's mental health is not too narrow of a niche. It's 50% of people. Women's mental health or men's mental health are great niches because they seem so specific to the patient. A patient who's in that niche is going to think, wow, this is just for me, but it still includes half of people. But let me kind of talk about the balance of how narrow is too narrow, because you're always just choosing. It's a choice between different pros and cons, and there really isn't anything that's too narrow, but there's some downsides when you're trying to grow to being too narrow. The ideal balance is being specific enough that a patient feels like you're talking to them while not seeming like you're excluding people. And there's like a delicate balance, and there's ways to phrase this on your website where you can frame a niche as like a subspecialty, but not limiting it to the only thing you do. With any niche, here's the trade-off. The more narrow you are, the more excited the right patient is going to be when they see your website. However, the fewer patients there are. You absolutely will grow slower the more narrow you are. People get in their head about that, like I'm doing something wrong, and if you need the income and you just prefer to grow really fast, then you might want to start more broad. But the more narrow you are, you're more perceived as a specialist and you can charge more. The more you are a generalist, kind of the more people want to pay like middle range fees, versus if you're a specialist and someone thinks you're really the one to help them, people are not comparing fees to someone else. They're like, wait, no, this is the person who can help me. Of course she charges double as everyone else. Of course he charges double. And they're not really like getting thrown off by higher fees. They expect it because they perceive you as so much of a specialist. A good approach for most people would be to start more general, like anxiety, depression, but then whatever your passion is, say that is a subspecialty. And as you grow and fill, stop seeing the more general patients and narrow down on what your passion is, even if it's very specific, and focus your marketing more on that more specific niche in terms of the referral relationships you build, or maybe if you're running ads, you're writing blog posts, you're doing YouTube videos or whatever, you're focusing just on that narrow niche. You know, and honestly, even if you have a really narrow niche, bread and butter patients are still going to find their way to you. You know, I know people who on their website, it's like, I only see women, and men still come to them, you know, for whatever reason. Usually it's because it's a personal referral or something like that. So you're still going to have the opportunity to see all kinds of patients, but you want to, like, as you're getting more full, probably narrow in on a narrow niche that you're most passionate about. The other advantage of having a narrow niche is it gives you the ability to develop your skill set a lot deeper. If you see everyone, it's hard to keep up to date on the research for every condition, you know, and keep up to date on everything, versus if you're narrow, you actually can be pretty up to date on everything that comes out for that group of patients. Like I've mentioned on past videos, for example, that I don't even try to keep up to date on like schizophrenia and psychotic disorders, because it's just not what I typically see in my practice. Every once in a while I do have a patient who's psychotic. It's usually because they present with something else and they end up becoming psychotic, in which case then first line approaches work in that case, or I might have to do additional reading. But to be really good at the things I do, I can't be good at everything. So when you specialize, that's a trade-off too. You probably have to turn off certain parts of your brain where I'm not focusing on this as much from a clinical standpoint in terms of my clinical knowledge base, so that I can get really good at this other thing. I know we all think of the demographic factors when it comes to defining a niche, women or men, or this race or cultural background, or this age, or this kind of occupation, but it's the psychographic factors, like how someone thinks, what their values are, what they believe, that really actually connect a patient with you. And sometimes I'll see websites, I'm like, oh, that's really clever, where they actually did not define a single demographic factor. They didn't define a diagnosis, age, a gender, an occupation, or any of that, but it's still very clear who they're talking to. It's like a person with a certain type of belief system, like who has certain preferences in terms of their treatment, certain desires in terms of the treatment approach. So you can completely define a niche with zero definition of demographic factors. And that might be a really good way to do it, where it's just in the patient's mind, right? If they connect with what you say, and there's nothing in there that actually makes them feel like you don't work with someone like them in terms of either age or diagnosis or something like that.